Welcome to the Heart Talk, a podcast dedicated to empowering you with the knowledge and habits that keep your heart strong and healthy. In today's fast paced world, where stress is high, lifestyles are sedentary, and processed foods often replace wholesome meals, heart disease has become one of the world's leading health concerns. And alarmingly, it's affecting younger people more than ever before. Hi, I'm Huma Qureshi, and in this episode, we're joined by a leading physician to help us understand how we can protect our hearts, detect early warning signs, and make choices that ensure a longer, healthier life. Together, we break down the science into simple, actionable steps that you can start today, because a healthier heart means a healthier you. So, doctor, tell me, why are so many people today, younger people, even celebrities, getting heart attacks at just 40? I mean, aren't heart problems for older people?
Hello, I'm Dr. Hitesh. And yes, ma'am, you told it very right. Currently, less than 40 years people are getting heart attacks, and which is mainly the workforce of our Indian population. The reason behind this is the heart attacks are usually occurring in young adults due to diabetes, obesity, smoking, and even stress, which is a major part of our lifestyle. Even the fit-looking individuals may have hidden risk factors like high cholesterol, genetic predispositions, and studies have shown that even in the Indian Heart Association have shown that 25% of the heart attack in India occur in people under 40 years. Especially the South Asians are at higher risk due to their genetics and even the lifestyle factors.
So, what are the warning signs that I should never ignore when it comes to my heart? And when should I see a doctor?
Ma'am, you asked very correct question as when should we seek a doctor's consultation or help? First and foremost, if the patient is having chest pain or having chest pressure, which is just here, which is known as Levine sign, the patient is having shortness of breath and fatigue even without a reason, means the patient is having feeling fatigue and chest pain even at rest. If the pain is radiating to arms, especially or jaw or back, and the patient is having pain and palpitations, dizziness or fainting, the most important thing is early detection saves lives. A delay in treatment can increase the mortality and the morbidity of the patient significantly.
And what are the most important daily habits that people can adopt to keep their heart healthy and to reduce the risk of heart disease?
This is very
And what
important
are the
क्वेश्चन
daily
फॉर जनरल
habits that people
पॉपुलेशन.
can
जैसे कि हम
use to
बचपन में
keep their
सुनते थे
heart healthy
पौष्टिक
and
आहार
reduce
लें,
the
अच्छा
risk of
खाना
heart
खाएं,
disease?
वही मैं फिर से बताऊंगा आपको कि प्लीज एवरीबडी गेट अ बैलेंस्ड डाइट विच इज रिच इन फ्रूट्स, वेजिटेबल, whole grains and lean protein, and we must exercise for at least 150 minutes a week. मतलब हर दिन आपको कम से कम आधा घंटे मॉडरेट एक्टिविटी, मतलब कि आप एक सेंटेंस बोलने में आपको थोड़ा सांस लेना पड़ रहा है, पूरा एक बार में नहीं बोल पा रहे हैं. और यू कैन गो फॉर रिगरस एक्टिविटीज ऑफ 75 मिनट्स पर वीक. ऐसे एक्सरसाइज जिसमें आपको एक सेंटेंस भी पूरा नहीं बोल पा रहे हैं, एक छोटे फ्रेज बोलने में भी आपको सांस लेना पड़ता है. And we must say everybody please quit smoking, reduce alcohol intake and also maintain a healthy weight. जो हम BMI बचपन में सुनते थे, आज भी हम वो उतना ही कारगर है. आपकी हाइट जितने सेंटीमीटर में है उतने किलो आपका वजन है तो अच्छा है. बाकी आप BMI के लिए ऑनलाइन कैलकुलेटर्स पे भी चेक कर सकते हैं. We must monitor blood pressure in the normal range, which should be less than 130/80, and our blood sugar should be in normal range. And most important thing, you start going for regular screening even if you are at crossing 30 years of age, if you are in a high risk population.
How much do diet and physical activity actually affect your heart health, and what are your top recommendations?
This is a very important question, that how much do diet and physical activity really influence our heart health? Up to 80% of premature heart diseases can be preventable with a moderate, healthy exercise and a healthy diet. The Mediterranean diet or the DASH diet, which we prescribe everybody who is in a hypertension range, the diet should be rich in high fibers and should be low on salt, and the patient should abstain from taking alcohol and smoking. It significantly reduce the cardiovascular event. एंड ऑल्सो हमें हमेशा रेगुलर अपना ब्लड प्रेशर चेक कराते रहना चाहिए। रूटीन 6 महीने साल भर में एक बार सीरम कोलेस्ट्रॉल और इंसुलिन सेंसिटिविटी की भी आपको इंफॉर्मेशन होनी चाहिए। द मोस्ट इम्पॉर्टेंट थिंग इज कंसिस्टेंसी इज मच मोर इम्पॉर्टेंट देन द इंटेंसिटी।
What about stress? Does stress actually affect the heart? And what are the practical steps that one can take to reduce it?
आज के ज़माने में स्ट्रेस एक बहुत ही कॉमन, क्या कहते हैं इसे, डिजीज़ हो गया है। स्ट्रेस has been become a much more important etiology of the maximum non-communicable diseases, which is the chronic stress. It increase the blood pressure, it causes inflammation and the risk of arrhythmia. Arrhythmia means आपका हार्ट कभी कभी जो नॉर्मल गति से धड़क रहा है उससे धीमे या उससे ज़्यादा या कोई एक बिना पैटर्न के धड़कने लग सकता है, arrhythmia. And the stress related to heart disease is a well documented among young professionals. जो भी यंग प्रोफेशनल हैं, चाहे वो टीचर्स हों या बैंक वर्कर हों या भी कोई भी जो है आपके स्टेट वर्क, सारी चीज़ों में इसमें स्ट्रेस ज़्यादा है, जिसमें पब्लिक डीलिंग है, कोई स्ट्रेस रहेगा। इन स्ट्रेस से हमें पता है कि डॉक्यूमेंटेड है ये स्टडीज़ में, इससे हार्ट के डिजीज़ के चांसेस बहुत बढ़ जाते हैं। सो हमें कंट्रोल करने के लिए क्या करना है, मोस्ट इम्पॉर्टेंट एंड जो हम आदिकाल से सुनते आ रहे हैं, योगा कीजिए, मेडिटेशन, डीप ब्रीदिंग एक्सरसाइजेस करते हैं जिससे एंग्जाइटी भी कंट्रोल आपकी होगी। एंड सबसे इम्पॉर्टेंट चीज़, हमें एक प्रॉपर 8 घंटे की नींद लेनी है। सोशल कनेक्शंस आपके होने चाहिए, यहाँ आपके दोस्त हों जिससे आप अपने मन की बातें सब बता सकें। एंड इफ़ यू आर रियली फीलिंग एंग्जाइटी और अदर थिंग्स, you must take a counseling and doctor's advice to lower your burden.
Well, as we wrap up today's conversation, remember your heart's health is in your hands. Every small change you make, from the food you eat, the way you move, and how you manage stress, adds up to a stronger, longer life. We hope the insights have inspired you to take those steps starting today. After all, your heart works for you 24/7. It deserves the same care and commitment from you. Thank you for tuning in. Until next time, keep your heart happy and it will keep you going strong.